Colonoscopies can be lifesavers, but they are invasive and can cause harm. We represented a client who underwent a routine elective colonoscopy that should have prevented health problems. But a nearly lethal combination of negligence and malpractice caused the young married father years of complications and pain, with 6 abdominal surgeries, multiple infections, and multi-organ failure. A colonoscopy is a common diagnostic test that many people undergo, especially once they turn 40 years old. One of its purposes is to screen for certain types of intestinal cancer. This is an outpatient procedure which examines the inside of the colon and rectum. This important test does pose risks, including perforation. An accidental piercing can be caused by even the most skilled medical hands. Promptly identifying and addressing a perforation is crucial. Should it occur, surgery is immediately necessary to repair the hole before the patient's insides become inflamed and infected from leaking bowel contents. Soon after our client's colonoscopy, he experienced multiple problems. He immediately felt worsening pain, pressure, nausea, and difficulty breathing. So he and his wife called the doctor's office 3 different times to alert them of his condition. Each time, he was negligently reassured by the office staff that he should not worry and that his symptoms were normal. They were not normal. Clearly, the way our client felt was not the way a patient should feel after a colonoscopy. His symptoms needed investigation. Once the pain reached unbearable levels, the client rushed to the hospital, but unfortunately learned his condition was severe and immediate surgery was necessary. Our client's colon was indeed perforated during the initial procedure, and the infection spread over time. The infection caused by the leaking bowel material required numerous operations, transfusions, and intensive care. This could have been prevented had the doctor's office responded to the patient properly by acknowledging his symptoms were not normal, they were alarming, and you should have returned to the office or have been rushed to a hospital immediately. We established that this was never done. Messages were not relayed to his doctor, and the wrong advice was given. We obtained over $2 million to compensate our client for his injuries following the perforated colon and the failure to promptly diagnose and treat the complications.